Dear students, today we will discuss a entity which is very common. All undergraduates and also of course postgraduates uh, should know this entity because it's quite common, important as far as your exam is concerned. Definitely in theory they will ask, Viva they will ask, Oxy they will ask. Practically it is important. You should know how to manage and maybe kept as a short case also in the exam. So everywhere it is very important clinically, and regularly we see these cases in our surgical OPD, quite common. So just find out what is this. See that in the neck we can see that there is a swelling, small sort of swelling. If you actually carefully examine this patient, any swelling in the neck, you have to think of physically first lymph node, then other conditions other than thyroid swelling, non-thyroidal swelling, that's what is classified. In non-thyroidal swelling it's midline and lateral, and lateral again bronchial cyst, tubercular tumor, then nodes, then so many other conditions, lymph cyst, all those conditions will come. And cold abscess is another thing. Tuberculosis, lymph node again, tuberculosis, lymphoma. Second is in the neck. The three conditions which you have to remember as a common neck swelling enlargement is tuberculosis lymphadenitis. Second is in the neck, lymphoma. Maybe Hodgkin's lymphoma or maybe non-Hodgkin lymphoma, depending on the age. Different criteria which I am not going to discuss. So these are the conditions which you have to remember. Here, look at this. This patient, adult lady, and painless swelling. She has come to our clinic and no pain at all. She is comfortable, but she slowly it is increasing in size, and multiple small swellings are there adjacent, which is not visible here. Few are visible, and clinically when examined, it is smooth, soft, fluctuant. Vegetative fluctuation was there. Skin is not. Skin is free, all area except the summit, and it's non-tender, not warm. And there are few multiple lymph nodes are there, same side, and few are on the other side. Other nodes are not present, axillary nodes are not there, and groin nodes are not there, abdomen nodes are not there, liver, spleen not palpable, spine is normal, oral cavity should be examined, oral cavity is normal, tonsil not enlarged, epitrochlear lymph nodes are not palpable, palpable lymph nodes are not palpable, lung or systemic examination found to be normal. So these are the basic thing you have to do always in all these patients, considering many differential diagnoses. So probable, what is this condition? It's a local there is swelling, some redness is there, but no pain. So this has to be cold abscess of the neck, and usually it's due to tuberculosis, commonly due to tuberculosis lymphadenitis. Occasionally tuberculosis from the other region can trickle down and from an abscess here along the facial planes or along the neurovascular bundle, especially when there is tuberculosis of the spine, cervical spine, C4 or 5 or 6, cervical spine tuberculosis. When it of neck stiffness, they'll have military attitude like this. They can't turn the neck. So because spine is involved, spasm of the spinal muscle occurs. And oral cavity, sometimes chronic retropharyngeal midline abscess will be there. Unlike acute retropharyngeal abscess, chronic abscess is due to tuberculosis. Behind the prevertebral fascia in the midline due to tuberculosis. These caseating material may trickle laterally along the facial plane and may form a swelling here, which is smooth, soft, localized, fluctuant, non-translucent, non-tender, not warm. So that is typical of the cold abscess. Here I said skin is not that free, so naturally it might have come out of the deep fascia. Otherwise these things are deep to deep fascia because most of these neck lymph nodes are involved are deeper lymph nodes, level 1, 2, 3, 4, 5, like that. So they are deep to deep fascia. But once it comes out of because of the tension, this breaks the deep fascia. Deep fascia get adherent to the skin and forms a swelling there under the skin and the deep fascia, and that forms a collar stud abscess like this. So actually it is a cold abscess with a collar stud extension actually. So it is, what is the meaning of collar stud abscess? It is commonly seen in the cold abscess forming collar stud as a nestate. Sometimes in the hand infection also it can occur, where it is a small area in between, wider area on either side, like a neck. On either side of the neck, there is a collection. So that's exactly collar stud, like a collar box, a small area, but it's connected. So that is a collar stud abscess where skin is adherent. and it is impending sinus formation actually, tuberculous sinus formation. So all of you know that the stages of the tuberculous lymphadenitis: stage 1, stage of inflammation, stage of matting due to periadenitis. It is a very typical feature of tuberculous lymphadenitis, as textbook mentioned clinically, is matting. Very typical. Periadenitis are adherent to each other, and stage of caseation necrosis forming cold abscess. Stage of cholesterol abscess comes out of the deep fascia, get adherent to the skin, eventually gives a forms a tuberculous sinus. So there are 5 stages are there. That's important thing. Very common short note hospital. Enumerate stages of the tuberculous lymphadenitis. So you should know. And there are 2 types of tuberculous lymphadenitis. Remember, one is hyperplastic, which is less common, 20%, where patient's resistance is very good, immunity is good, where it is not adherent to each other. So discrete, firm lymph node mimics sometimes secondary, sometimes lymphoma and so on, but never forms a caseation. So anti-tubercular drugs reaches very well there, and it gets recovered. They recover very fast. Resistance to the anti-tubercular drugs is uncommon. Whereas caseating tuberculosis, there is a caseation necrosis. Central part drug may not reach because no blood supply over the necrotic material which contains the bacteria actually. So recovery is slow. Abscess has to be drained there, whereas in hyperplastic surgical intervention is not required. But 80% of the tuberculous lymphadenitis is caseating type, remember. So most of the time when you say tuberculous lymphadenitis, we think of cold abscess, cholesterol abscess, sinus formation, multiple matted lymph nodes. So all these are features of the caseating type. Matting is not common if it is hyperplastic type of tuberculous lymphadenitis. So the staging is important, which is commonest type also important, caseating type, hyperplastic, and fibrotic type, one more rare type is there. Mainly 2 types, caseating, hyperplastic, rarely fibrotic type, where fibrosis occurs because of the reaction. So these are the different types, mainly 2 types. So these are the things which you have to remember. So typical cold abscess, how exactly it looks, this is the exact picturized look actually, understood? So what you will do, so types I have told. So I already told differential diagnosis, lymphoma. Second is in the neck, which is very hard, stony hard. Second is lymphoma is India rubber consistent, very typical India rubber consistence. And many lymphadenitis, bacterial lymphadenitis, viral lymphadenitis, so many lymphadenitis. And remember, all these things is common in HIV patients. So HIV has to be thought of. The neck lymph node enlargement is quite common in HIV patients. So HIV has to be thought of in all these patients. This is another thing which you have to remember. So it's very clinically, very, very clear. Cold abscess is diagnosed. Of course, 2 or 3 differential diagnosis, and also keep HIV in mind. And chest X-ray as a primary focus is important. Chest, lungs has to be examined, I already told. And other lymph node region, oral cavity. You know that any neck swelling, oral cavity has to be examined. Any oral cavity, neck has to be examined. I think other neck swelling, lymphoma, secondaries, we had already discussion. Earlier recording sessions, my session lectures are having detail about lymphoma, secondaries in the neck lymph node examination also we had detail. Students can always go through those lectures, earlier lectures, brief lectures about detail about those conditions also. And so how we will evaluate? Do ultrasound, do chest X-ray. Now currently of course they do CT scan and do FNAC, confirm it contains caseating material, very typical caseating material. That material you can send it for AFB, you can send it for culture, mainly AFB, culture, and you can send it for bacterial, that's AFB, bacterial acid. And cells you can see, epithelioid cells are very typical. Epithelioid, Langhans giant cells, typical are epithelioid, they are very diagnostic. They are modified histiocytes, becomes a flat epithelioid cells, giant Langhans cells. These are the 2 cells which are very specific, very important when you diagnose tuberculosis and tuberculous lymphadenitis as such. Again, remember, tonsil should be examined. This is a very common focus. Posterior triangle is very common. Other areas it can occur. First is commonest site of tuberculous lymphadenitis is the neck. Then, of course, axilla can occur, groin can occur. Other areas also can occur. Seen all areas of tuberculosis, very common, especially in the developing country like India and other Indian subcontinent. It's very common. So every type of different tuberculosis presentations we have seen. Spine should be examined, cervical spine. And CT scan, when you take, always spine should be involved. Spine should be taken, included while taking the CCT head and neck region, including thorax. So that primary focus, if it is there in the lung, not uncommon. So it should also be identified easily through a, so CT, head and neck and chest is the common thing which you have to do. Ultrasound abdomen you have to do. And liver function test also, ESR may be high. So blood parameters are important. Patient may be diabetic, especially elderly people. So you have to look for the diabetes also. HIV has to be checked for. Immunosuppression has to be looked for. So all these things are important. Detailed, complete clinical examination and other areas of examination, oral cavity examination are very, very crucial in this patient. Remember, so examine all. I already told examine oral cavity, other lymph nodes, systemic examination, lung, spine is important, abdomen. And remember, when you say spine, commonest spine nodes are T10. That is MCQ question. Remember, throughout. Okay, here of course we are concentrating on the cervical spine. So all these investigations, epithelials are very typical, and many times you have to do an open biopsy if FNS is inconclusive. You have to send a biopsy, and also you have to send for a tissue culture also, AB also. So that is how exactly will confirm the tuberculosis as such. And treatment I already told, investigate ESR, monitor with CBC. LFT is important because anti-tubercle drugs like rifampicin, isoniazid, pyrazinamide, all the things are hepatotoxic. So suddenly liver enzymes may increase. In such a situation, we may have to change the drug, where less or reduce the dose, or drug which does not have a hepatotoxicity we have to think of. So that's why adjustment of drug, duration of drug therapy also important in these patients. And recurrent cases, treatment is, that is enough. Aspiration is important. When there is a cold abscess, aspiration has to be done. No, important thing is in the aspiration is non-dependent aspiration, especially technically, principle-wise, non-dependent. So your track should be zigzag, puncture the skin, go the abscess wall in the different areas so that sinus will not form. So zigzag approach through the needle and aspirate. That is important. And when you drain it, open drainage, curate everything. Sometimes we used to pour tetracycline powder or gentamicin solution over the cavity and close the suture very securely without drain. Drain if you place, it may form sinus. That is the older principle, but still we don't use it. And in extensive lymph node involvement, recurrent cases, you may have to raise the skin flap and remove all diseased tissue, like not radical neck dissection. It is a extensive lymph node removal. I won't say it's a dissection. Dissection word is always used in oncological point, where it is a inflammatory disease, infective disease. So here, wound excision, wide, adequate, proper wound excision with the proper skin flap raising and removing everything is very, very crucial to prevent the recurrent sinus formation, disability to the patient, and also it increases the efficacy of the drug because drug reaches there, and also it prevents the to certain extent drug resistance. So that's why proper wide clear or removal of the diseased lymph node in recurrent cases and all sinuses, scar tissues, that's very, very crucial in many recurrent diseases which we come across. We do such surgeries. That's why this point is very important. So again, students, you can always read my SRB's manual of surgery and my SRB clinical methods of surgery, how to examine neck swelling, how to examine cold abscess, how to manage cold abscess. My manual is very well purchased, and because everything is covered there. And also, students, I request please subscribe my YouTube channel, SRB Surgery Insight, and share with your friends and colleagues, and press the bell. And also, every day brief lectures are coming, so 6 to 10 minutes, which covers images, X-rays, instruments, operative brief procedure, clinical cases of different interesting type, and briefly techniques, different aspects of the surgical surgery daily for short period, 5 to 10 minutes. It's very, very useful. You can learn surgery interestingly daily, so they update your surgical knowledge on day-to-day basis. And also join our live session once in 2 to 3 weeks, where 1.5 hour session is there. Student will present live, and other than myself, senior professors will join and interact, like mainly like in clinical cases like hernia, breast lump, thyroid, mass abdomen, swellings, ulcers, peripheral vascular disease, varicose vein. So those live sessions are already there. You can always go through those live sessions, and live sessions are coming eventually also. If you join live session, it's very interactive. You can interact also through the chat box. And also, if you join the live session, you'll get a certificate which will be very, very useful for your future career. Again, students, I request join the YouTube channel, subscribe it, it is free, so that you upgrade your surgical knowledge. Also inform friends to subscribe and go through view the YouTube channel daily lectures. That will be very useful. So student, answer the MCQ and put the answer in the comment box. I appreciate or acknowledge your answer box. McPhee incision is used in A, B, C, D. Put the right answer. I'll put it in the comment box. Another MCQ in secondaries in neck, single ipsilateral lymph node less than 3 cm with the ENE, extranodal extension spread, becomes nodal staging as follow. A2, 3, A, B, C, D, N2A, N2B, N2C, N3A. Put the right answer. I will appreciate and acknowledge your right answer, students. And also, quotation of the day is, heart that forgives is the heart that heals and feels. So forgiving is the very important aspects of human life. It's not everything you can give revenge, but important decisive forgiveness. Every individual major bad thing, major mistakes, you can't forgive. You have to penalize for such individuals. Otherwise, overall day-to-day your aspects of life, you should not provocate things. So you should better to forgive and forget and go ahead with your life. That is exact meaning of this quotation. Very, very important quotation, especially in surgery. So students, again, request to subscribe my YouTube channel and increase your surgical knowledge and share with your friends and colleagues and press the bell. So students, I hope you understood this lecture very well. Students, see please go through, purchase my SRB's Manual of Surgery, current edition, which contains all surgical chapters with the quotations, with a lot of photos, illustrations, clinical approaches, principles, and treatment aspects. It covers general surgery, it covers endocrine surgery, thyroid, breast, peripheral disease, varicose vein, gastrosurgery, so everything is covered, and urology, neurosurgery, cardiothoracic surgery, instruments, anesthesia brief chapter, adjuvant therapy, everything covered as far as CBSE, as far as CBME syllabus. It is covered everything for students. There are quotations, illustrations, photos, briefly operative technique, and everything. Please purchase my manual. It is more than enough to understand surgery as such. And also purchase my clinical methods in surgery. Every examination is covered. General examination, like other examination which is important for students, hernia, hydrocele, immunoscrotal swelling, breast lump, thyroid, abdomen mass, peripheral disease, varicose vein, all aspects, in detail examination method with the principles and lot of photos. It is under differentiated in the tabular form, but there are no management concept because it's only clinical book. And each chapter has got a video which shows how to examine this. For varicose vein, there is a video. QR code is there. You can always scan and go through that examination. Same thing for mass and other things also. Briefly, orthopedic also examination is there, and it also contains instruments, specimens, brief operative procedure also. It is very, very useful for students when they take the clinical examination. So how to examine a patient, it is very detailed, very, very useful, and rather best book for clinical methods, I could say. So please purchase my clinical methods in surgery, and also my new edition operative procedure, extensive voluminous book, in detail technique, every small procedure to major procedures, all covered, everything in detail, including GI, with the 2-volume book, more than 10,000 photos and illustrations, step-by-step explanations with the photos, illustrations. It's a very, very useful book for operative procedure, all consultant, also upcoming surgeons, postgraduates. You can go through this book and before doing the surgery, it will be very, very useful again. To students, especially postgraduates, please go through my current edition operative surgery, also SRB's operative surgery atlas and test, and my small atlas of tissue approximation is with the video of how to approximate the tissues. Very, very useful to learn the suturing technique. 100 pages brief book with the video also, how to suturing, different suturing, bowel, skin suturing, different types of sutures, laparoscope suturing also briefly mentioned. That very, very useful. So students, kindly purchase my book and go through that and enjoy the surgery as such. And also please again request subscribe my YouTube channel, share with your friends and colleagues, and press the bell. Students, I hope you have understood my lecture very well. Thank you so much.